All right. Good morning again. I know we have members of the media here in the audience, and some of you I have had a chance to meet with. If you're here, a member of the media, you need to speak with me. I'll be stepping off shortly after remarks, and I'll be happy to give an interview. So again, good morning. I appreciate you guys so much for taking out the time in your day, your clinical day, on behalf of your patients. Again, I'm Dr. Nancy Herlock. I am the president of United Advanced Practice Registered Nurses of Georgia, UAPRN. We are here today for a very important reason. But before I get into that, let me just acknowledge the fact that we have members of our board here. Dr. Valencia Fleming is here. Dr. Shannon Witten, Director at Large, is here. We're going to get remarks from members of our community, our advisors, and they'll introduce themselves when they come to the mic. I also want to acknowledge our lobbyist, Juliana McConnell. Most of you have seen her on the calls. Juliana has been advocating on our behalf for the last 10 years. You'll also get to meet members of our Government Relations Council who's interviewing right now. And we're wearing different hats today, so we appreciate your patience and your time. And by the way, this is for you guys. The formalities are just that. We want you to also equally be comfortable telling your stories to the mic here, or if you choose to do it directly with one of the reporters, don't feel restricted. This is not an exclusive club. This is not what this is about. We put this on today because we knew the importance of the meeting that happened across the street. We knew that there was going to be limited seating, but we did not want to restrict you in telling your stories and lending your voice. So with that, a little bit about the organization for those who are not aware. UAPRN has been around for 20 years. This organization is very heavily rooted in advocacy and policy, but we're also very committed to the mentorship and support of APRNs in the state of Georgia. That takes on many forms. So I'll take a little bit of a liberty at this time to recognize that we have programs such as Elevate, which Dr. Shannon Witten oversees, that is specifically focuses on nurturing new APRNs, but also soon to graduate APRNs. We have chapter engagement with Dr. Valencia Fleming and Regina Canty, our secretary, who couldn't be here. They are literally going across the state, opening chapters. We recognize that membership, and if you guys have seen any of the videos on social media, membership is where we're going to have and lend our voice. Right now, our membership, shortly before the recording of that video, was about 600. I'm happy to say as of yesterday, it went up to 725, which we're glad. Yes, indeed. But listen, 20,000 APRNs in the state of Georgia, all in, not just MPs alone, right? When Juliana and Robin and her team go to the Capitol, when we sit in those rooms and advocate, we need a force behind us. We need to be able to say we are really, truly speaking on behalf of all APRNs. That comes in the form of membership. And the reason why I took the time to talk about Elevate and membership engagement, we recognize that policy and advocacy is not something that either you are able to or comfortable doing, but UAPRN is so much more. We want to be the platform that you feel comfortable coming to when you say, hey, I want to be the next president of UAPRN. I would love to have that conversation. The next president is here right now, but the way in which you will be prepared to be the president and lead this group is through mentorship. But we don't know who you are because we haven't met. You're not a member. Shout out to those who were on the calls the last few weeks on our Zoom. Shout out to the comments that went out in the chat, because believe it or not, we take all those comments, we bring it back to the table. I gotta give a shout out to Mike. Mike, you know who you are, I'm not gonna point you out. Mike gave us the business in the comments, and we were like, you know what, Mike? And he did, he came. Shout out to Mike. But I point that out because we're not immune from comment, we're not immune from rebuke. We are open to your comments, and the only way we're gonna grow is we're gonna do it together. So with that, I wanna meet all of you. I'm gonna walk around and shake hands, but I'm gonna now shift gears to the next speaker, and we're gonna allow them to come up and introduce themselves as they come up. Thank you.
Good morning, everyone.
Good morning.
Thank you so much for taking time away from your patients, your clinics, and recognizing how important this event is. I'm Robin Pinchton. I'm Director of Government Relations for UAPRN. We have a fantastic team. Some are here today, and we've been fighting on APRN's benefit for several years now. Juliana McConnell is our lead lobbyist. She is over here. We are down here across the street at that Gold Dome 12 months out of the year. just not during legislative session. We have tried to pass legislation to remove barriers. We continue to do so. However, today was pivotal, very pivotal. As you all know, we had a position statement that came down from the Composite Board of Medicine without notice. Juliana and I were given the notice an hour and a half before it went public. I'm also a practice owner. So this position statement affected me and my 1,000 patients on a very, very personal level. What the Board of Medicine is stating, they are reinterpreting a regulation that has been in effect for approximately 15 years. Now remember, this is a regulation. It's not statute. Statute states we cannot directly compensate a physician, directly or indirectly, for their consultative, collaborative, supervisory services. This reg now reinterprets that to say that we cannot pay our physician for their services, and they should have compensation, right? Who's going to consult for free? No one. So this says we cannot pay them through any means, including third-party vendors. And we'll have a third-party vendor come up and have her comments as well. This was released right before the Memorial Day weekend. We started hearing tricklings of this a few weeks before. We were talking to Tara, the director of the Board of Nursing. All of a sudden, protocol agreements are getting denied, and we don't know why. When we come to find out, the Board of Medicine added a number 12 to the template, to the protocol agreement, that states to your physician, if you are receiving compensation for your supervisory duties, select yes. Well, they're selecting yes, they're going to be honest, right? Well, there's an automatic denial. This led us into a holiday weekend with uncertainty, lack of clarity. Do we shut down our clinics immediately? Because those of us that are paying our providers through third party, per that regulation, we're not doing it the right way. I've had phone calls. I have had nurse practitioners calling me in tears. They finally were able to start their dream of their own practice, a psychiatric practice. They did everything they needed to do. They had their business plan, they had their lease space, they came up with their staff, their equipment, secured SBA loans. The last thing was that protocol agreement. They put it through and they were denied. This nurse practitioner now has no way to make income from this practice, and now potentially could go bankrupt because of everything that she put forward, right? That should not be allowed. We have patient statements. We have perinatal psychiatric providers, APRN providers with practices, serving a very, very specific, frail population. Their patients are very concerned. This is the only nurse practitioner that addressed her very specific need of her psychiatric issues while she was pregnant. Our maternal mortality rate in the state is at the very bottom. It's horrible. This patient is going to lose access to that one provider that has provided her so much security, treatment, and understanding through her pregnancies. So what we have asked the Board of Medicine, we've asked the Board of Medicine to rescind this statement. We've asked them to be a part of the Composite Board of Medicine. They regulate us, but we are not a voice at the table. We do not sit on that board. We need to be at that table. So right now, across at the Twin Towers right there, the their executive session, we just presented to them, they're deciding the fate of thousands and thousands of patients' access to our excellent care. So we'll hope we'll get a good response here. So with that, I'd like to turn it over to the next speaker. Is that Pam?
Yes.
Pam?
Thank you. Thank you, Robin. Good morning.
Good morning.
How are we?
Good.
Thank you for coming out. We have all just spent about the last 2 hours cramped in a very tiny room, but advocating on your behalf. I am so pleased to be here. My name is Dr. Pamela Urgrabish. I am a cardiothoracic nurse practitioner for the last 25 years. I am also the Vice President of Clinical Operations at locumtenens.com, which is a division of Jackson Healthcare. We are the placer of the most 1099 nurse practitioners across the country. We recognize how valuable nurse practitioners are to practice everywhere, but especially in Georgia, right? Georgia relies on its nurse practitioners, especially in rural areas where there is no physician to see those patients, where we are the only point of access. And to Robin's point, we are required by law in this state to have a collaborating physician. By law, we comply. We want to comply. But that requires us to compensate those doctors for their time, to perform chart review, to be available. And for right now, no matter how much experience a nurse practitioner has, they are required to have a collaborating physician. Now, many states in our nation have moved away from this opportunity, but Georgia still sits as one of the most restrictive states in the country for nurse practitioner practice. And I want to be clear, we support appropriate oversight and we support genuine collaborative relationships. But the statement that was, and we understand it's been on the books, but the way that it was re-brought up and reintroduced is causing severe confusion and crisis. We are watching physicians exit collaborative agreements. We are watching practices close. We are watching people who have poured their hearts into their practices have their dreams leveled. But the worst part is we're denying access to patients that critically need care. And every single person standing out here in a jacket today, in scrubs, in a suit, if you supply care to patients, I applaud you. Thank you for everything you're doing. Thank you for being here today to support us. I do want to tell you what we have asked the board. For immediate clarification of the position statement's language to distinguish genuine, clinically active collaborative arrangements from bad faith compliance. To explicit acknowledge that third-party matching services when facilitating clinically appropriate NP-physician relationships serve a legitimate and necessary function in Georgia's healthcare delivery system. And by a show of hands, how many of you have wonderful collaborative agreements with doctors that you appreciate? Put your hands up, show them high. I know the cameras can't see you, but that's every single person standing behind me. We appreciate those physicians that enter into those agreements with us. Thank you for standing with us. And they want clarification too from the board. They have questions. We are also asking for a formal requirement that all future policy changes materially affecting nurse practitioner practice be subject to a minimum 60-day public comment period with genuine stakeholder engagement prior to issuance, and the placement of a qualified and vetted nurse practitioner on the Collaborative Board of Medicine. We have no representation. We are the stakeholders in this. You are affecting our patients, but we have no voice. And a 1-year implementation runway for any large-scale changes that impact NP practice or collaborative arrangements, giving NPs and physicians the time to identify compliant paths forward without disrupting patient care. Georgia's patients cannot wait, can they? They cannot wait, no. The practices that serve them cannot sustain this uncertainty. We ask the board to act with urgency, and we hope that they are doing so now as they deliberate. And we hope that they will commit going forward to making policy with us, not without us. Thank you.
I just want to acknowledge something here. So we talk a lot about empowerment, and you guys heard me say earlier that you guys are empowered. How many of you are on your social media accounts? Please go live, and please post them serious. Look at it. Does this represent the state in terms of APRNs? We're grateful for the crowd, but you guys, this is what we need. The advocacy, if you haven't tagged us, UAPRN, please do so. If you're not live, go live. We need more people advocating on this cause, and allow the next speaker to come up.
Hi, everyone. I'm Matt Caseman, CEO of the Georgia Nurses Association. Thank you for coming out. I'm tired. I'm tired of this. I'm sick and tired of this. This is ridiculous. All we hear about is access to care over there, over there. It's all about access to care, but they're doing nothing about it.
That's right.
Because of this decision, thousands and thousands of patients are going to lose their access to care. Millions of patients are going to lose their access to care. It's ridiculous. 10 counties in the state of Georgia, around there I believe, do not have a family physician. 8 counties in the state of Georgia do not have an OBGYN. Think about that for a second. You know who's in those counties, I bet? APRNs. You know who's willing to go to those counties? APRNs. You are providing critical access to care in those counties. And let me say this too, with what these speakers have already said. This is not only an access to care and healthcare issue. This is an economic development issue.
That's right. Come on, Matt.
Thousands of patients. Who's going to want to come bring their business to those areas if they can't even get into have any access to care? Who's going to want to come to those counties? This is an economic development issue, and some of these nurse practitioners have 10, 20 people employed under them. They're providing valuable services in areas that would never get it. So I thank you for being here today. This is a fight that we will continue, and I appreciate everything you do. Thank you.
Hello, everybody. You can tell I'm a little bit more southern Georgia, obviously.
Go ahead.
So, long story short, my name is Lynn Brown. I'm a nurse practitioner that owns a practice for almost 10 years now. I am from Middle Georgia, and I actually am starting the Middle Georgia UAPRN chapter, so please join. We're going to start our first meeting in June. We wanted to get through today's conversation and see where we need to go from there. So please join UAPRN and get out and let's get motivated. So long story short, I'm going to keep it real quick. I own 3 locations. I have 5 NPs besides myself that work with me. I have 27 employees and about 10,000 patients. If we lose the ability to take care of these patients, especially in rural Georgia, you're going to have over 3 million patients that don't have access to care. If you go to see a doctor in the town I live in, which there's 3 full-times and 2 part-times, if you see one of the doctors or physicians there, you're looking at, if you're sick, a 2 to 3 week wait, and if you're just a new patient, 3 to 6 months. So we take walk-ins. Most of ours do. I know.
Can't lose lead.
So we got to stay active. We got to get out here and get involved. And y'all, we got to get past the nursing mentality that it don't affect me, because dang sure it does. Okay? We are still nurses. We need the nurses that are registered nurses, LPNs, the APRNs of all kinds. We need to join together. We got to rise up. We got to fight, y'all. We got to let them know. We appreciate the doctors that do supervise us, and we thank the doctors who support us. I have physicians calling me, asking me, how are we going to handle this? I said, you know what? I don't know. We're going to have to see what the Composite Medical Board says, and then we're going to have to figure out what to do to be able to stay open. I mean, it's not fair for a physician to take on the liability of, supervising a nurse practitioner and doing all the extra steps that they have to do to oversee us and not get paid for it. It's not right, it's not fair, and I think this is trying to shut us down, and we're not going to take it, y'all. We're going right. We stand. We are here. and we're going to stay, and I hate Atlanta as much as I possibly can. But I'm coming to this capital again. I'm contacting my representatives. I don't care if they're Democrat, Republican, Independent, I don't care. We have got to work together, stand together, and support each other. There's enough patients to go around for everybody, including the physicians. Get together, get a chapter going in your area. If there's not one, call UAPRN, Valencia right there, she'll help you get started. So, and they're actually having a leadership training June the 13th up here in Atlanta. So y'all come on, get started, let's get going, and let's don't let them shut us down. And if y'all need me, I'll give you my phone number, 478-231-8593. Call me, I will do whatever I can to help you.
Let me just, just to highlight what she's referencing, June 13th on our website, you'll see it. One of the things we talk about mentorship is free to members. It's called Calling All Leaders. If you want the opportunity for mentorship, it's there. And with that, we'll transition to the next speaker.
Good morning, everybody.
Good morning.
It is so awesome to see my sisters and brothers out here celebrating united together nurse practitioners. I think it's very important for us to come together and remove barriers that keep us from providing that essential care. My name is Shonda Hartley. I own a practice that we got a certain little niche. We provide primary care to residents in assisted living. These residents cannot get out and go to the doctor. These residents cannot get out and go to a specialist. So we go in and we have built a network where we actually send in x-rays, do blood work, whatever we need to do in that facility to keep that patient going. It is for us to provide them with a quality of life. We cannot do that if they cannot get to a doctor. We cannot do that if they cannot see a nurse practitioner. So I am in over 60 buildings, and we have about 700 patients that we actually provide care for. And we have a few home patients that cannot get out. So what are we going to do with those patients that is up in Cedartown? What are we going to do with them?
What are they going to get?
What are they going to get? We need to fight, and we need to fight hard, and we need to continue this battle knowing what is at stake. We are at stake.
That's right.
So please join together. Make your voices heard to everybody. Thank you.
Hello, my name is Jane Murray. I'm from South Georgia. I have a clinic in Valdosta and in Baxley, and this is not my thing, speaking in front of people. It makes me a little nervous. I'm glad to see people here, but I want to speak to the ones that are behind the camera that are watching from home. We need you. We need your support. And it is not just the nurse practitioners. It is the nurses. This is the future. What we're doing today is protecting what our daughters and our sons will do in 20 years from now when they come into this profession. It is about our job right now. It is about our patient care. It's about access to care. I have 2 clinics, and patients drive hours. They drive past doctors to come see me. And they always say, why are you different? Why is my doctor not explaining these labs like you do? That's because we are different. We do it different. We treat people different. We listen to what they say. They don't have to convince us. We don't have to be convinced that they need our care. We're here for them. And that's what makes us different. But we need all the nurse practitioners. We need all the nurses to support this. You don't think it affects you today, you don't know where you'll be in 10 years. Will you be self-employed? You could be. I had no idea 10 years ago that I would have 2 offices and this would be my full-time job. It is an honor to take care of patients, but it's also my duty to protect this profession for the nurses coming up. We need to be here. We need to be here. I love seeing all these people here, but there's thousands that are out there that will see this on video, and we need you too. Yeah.
Amen. Very good.
I noticed there were some that just came in when we started, so let me just reintroduce myself again. I'm Dr. Nancy Herlock. I'm the president of UAPRN, but I wanted to piggyback on that last comment. We all know right now, APRNs, that were you surprised when you said to them, hey, have you heard about the ruling, and they didn't know? Yep. Right? So I say that to say that we're passionate about it, and as we should be, but it is equally our job to educate those who say it's not affecting me. Yeah. But here's how it really does. If you're the APRN in the hospital or the doctor's office that maybe you don't own your own practice, but you're discharging the patient back into the community. When you write that discharge order for primary care, see your primary care doctor in 7 days, and didn't bother to even ask, do you even have a primary care doctor and or provider? Guess what? A lot of times those patients that don't have the primary care provider, guess who they're coming to? The Robins and the Chandras and all the primary care providers you see represented here. They're the ones that are seeing those patients. So what does that translate into? We're literally absorbing a gap. But for the APRNs in this state right now that own practices, those patients would have exited your hospital, your specialist office that you told them to see their primary care, they would have exited without a primary care option. So for the APRNs that are here under the sound of our voices saying, it doesn't impact me, if you care at all about patients, access to care, it does affect you. So I encourage you and to really just change your mindset. And with that, we'll transition again to the next speaker.
Hello, everyone.
Hello.
Yes, and I expect us to be fired up and ready to go. I came off a plane last night and I got up this morning because I need to be here.
All right.
I am a retired or semi-retired nurse, but I need to be here. I've been here for better off the 20 years of the UAPRN. By being present, we saw prescriptive authority came into place. By being present, we got DA numbers. If we are not present, nothing gets done because we are being eaten at the table instead of being part of the table, giving our voice. So we need to show up, and not only show up here, but show up locally. When our legislators are in town, show up. One-on-one, you look them in the eyeball and say, we need change, we need the people to be represented, and we don't want you to tell us at the legislature that you're going to do it, but then when you get out, it's not done. We want work, and we need to hold our legislators accountable, not to give us a quick talk and move on. And this year it's election time. Remember, our votes count too. Remember, our votes count. And your family vote and everyone. So we are not going to be silent anymore. I am going out. I could say stay in your bed today, but I'm saying our retired people, we have time. We are going to get up and we're going to continue to support our profession. We are nurses until we die. Okay, I hear you didn't hear. I'm Dr. Marilyn Hall. I've done it all, home care, veterans care, usually serving people who are underserved. So I understand their needs. We know when we sit with them and they have nowhere else to go, there's a referral, but they can't get the referral because the safety net clinic does not offer you a referral to a specialist, and you need to go get further care. So we can give care, but if the care is dead end, then we are not providing good health care.
When I say fired up, please say ready to go. Fired up.
Ready to go.
Fired up.
Ready to go.
Fired up.
Ready to go.
What I love about today is there is a uniting happening between physicians, RNs, UAPRNs, stakeholders, associations, the Georgia Nurses Association, the UAPRN of Georgia. I love how we are all so united. My name is Hannah Williams. I am a nurse turned attorney. I have a law firm here in Atlanta where I represent all healthcare professionals. I've seen a lot of my clients here today. I'm not going to identify you because I can't, but hello, hi, how are you? I am so concerned about this position statement, and I want to be absolutely clear about what the statute says. The statute says that a UAPRN cannot employ a physician. It does not say a UAPRN can't pay a physician. Oh. Let's be clear. I read the law. A UAPRN cannot employ a physician. What the position statement does is it takes the term employment and it interprets it to mean 1099 and third-party companies.
Come on now.
My head is spinning.
Your whole body's spinning.
My whole body is spinning.
Yes. Yes.
And that's why we are all here.
Yes.
So we have to be very clear about the regulation and the statute and what it says and what the position statement says, okay? Let me say that again. The law says a UAPRN cannot employ a physician. It does not say a UAPRN cannot pay one. Now, I am very, very, very strict about not interpreting the law the way you wanted to interpret the law. Like my mother had rules on the refrigerator, and we couldn't interpret her rules the way we wanted to interpret the rules. It's the same way with the law. I've been following the law all my life. And now I fight for Georgia nurses and APRNs and all healthcare professionals to uphold it. I'm glad we're able to come together today. I think that there should be so many more people here, as many phone calls I've received in my office about this issue. I wish that we were packed out with overflow room, but that's okay because people have to work, right? And it's a early morning on a Thursday. However, please know that there are thousands of APRNs across Georgia who are affected by this. And more importantly, why are we here? Why did I become a nurse 26 years ago? Right? To take care of patients.
That's right.
I miss the bedside. I love the bedside, but now I get to take care of you all as an attorney. And what I will say is that the focus for the medical board and for the nursing board has always been the protection of patients. And I believe that that is what they work hard and try to do every day. But this position statement misses the mark. It needs to be immediately withdrawn. That is the action item. Withdraw the position statement. Say that with me. Withdraw the position statement. Withdraw the position statement. Withdraw the position statement. That is the call to action. That is why the story that I heard during the medical board meeting where a patient couldn't get her medication and had a psychosis. That should have never happened. Amen. And look at all these UAPRNs and some physicians and stakeholders out here trying to make sure it doesn't. Thank you for allowing me to speak, and thank you for all the wonderful work you do. Nurses, UAPRNs are my favorite people in the entire world, and everybody knows that.
Hey, thank you, my darling.
Hello, I'm Lisa Johnson, Family Board Certified Nurse Practitioner. I represent the North Georgia area, right up on the North Georgia. Whoops. Is that better? North Georgia area, which is right up on the Tennessee, Georgia, North Carolina line. So, why am I here? I'm here for my patients. Number one, it has become a the word I'm looking for, passion of mine to make sure that my patients have access to care. We're in a rural area. Yeah, there's a vacation spot or two around there. Anybody from North Georgia in the area? All right. Get with me later. Knowledge is power, and yes, I ran into some folks that did not understand the ruling and what an impact that is. Again, about our patients. I think a lot of us went into this, the majority of us went into this to take care of people, bottom line. So, and making sure that they have access to care. So what has come down the turnpike is not working to take care of our patients, number one. Never thought I would ever be on a GRC committee, thanks to Robin. Came in kicking and screaming with that. Because like some other folks said, never thought I'd get up here and do a public speaking. But when you are motivated to take care of your patients, you will step out and step in and speak up.
That's right.
Okay? So just know, anybody can do it, because I'm up here. nervous as all get out, but regardless, think of your patients, okay? Number one, we're here for our patients. Thank you.
Thank you. And I think some of you heard the term GRC. I always like to take the opportunity to explain and expand. So UAPRN, United Advanced Practice Registered Nurses of Georgia, we have committees. One of the committees that falls under UAPRN is the Government Relation Council, which is GRC. You see them on the legislative sessions, the updates, and they're the ones that are actively engaged with our lobbyists during the legislative sessions, certainly throughout the year. So when Lisa Johnson referenced Robin and joining GRC, that's the committee that she was referring to. So we certainly appreciate Lisa and all of the team with their work. We have someone else coming up for remarks. We'll allow her to come to the mic and introduce herself.
Hello, everyone. I'd like to thank you all for coming. I wish, like she said, more could have came because we need more support. We need every hand on deck. But I just want to say, my name is Natalie McCall-Gaston. I work at, I have a practice in Lithia Springs, Judith Ruth Medical Center, and we see everyone. Now, we're not in the rural area, and I do give my props to the rural area. But at the same time, there's a lot of Medicare, Medicaid, strictly patients who need our services. These doctors are not taking them. They don't pay them what they want, so then it leaves them with no one. We have to be there. We have to fight for our patients. We've always been advocates since we've been RNs, LPNs, CNAs. We need to do it now. And if they cannot amend this, and I'm going to say it for myself, I'm not speaking for the group, but then if this is a problem for us to pay a doctor, then we need full practice authority.
That's right. That's right. That's right.
All right, we appreciate the comment. I think we have a few more formalities, and let me just go ahead and say we will be asking all in the crowd to come up so that the media can get a group picture. So if you're in the crowd, hold tight. When we're done with the formalities, we'll be switching to that opportunity.
Good morning, everyone. I am Dr. Valencia Fleming. I am the Vice President of UAPRN. I am honored to serve under Dr. Nancy Herlock. She is an awesome president. So let me just say this. I am very passionate about grassroots, okay? In order for us to get things moved, we need a grassroots movement in this state. So I am the person that she mentioned about starting new chapters. So I had a saying, I've been to 3 meetings, state meetings in the last few weeks of chapters. Each one, reach one. Say that. Each one, reach one. Each one, reach one. Each one, reach one. We have to reach out. This isn't a new message. You've heard it from all the other people. We have to reach out to our colleagues, to our friends, whether they work in the hospital. This is no skin in my game. I work for a company that does house visits. I don't have a practice, but I'm gonna stand up for every person who has a practice, everyone who's been affected by this. We have to stand together. So let me give you a little tidbit that Lynn didn't say. She and I talk all the time since we've met. She meets with a lot of legislators all the time. She almost meets with just as many as our Government Relations Council. This is what one of them said. Nurses did not work together. He said, you will always fall because nurses don't work together. One nurse comes over here and says this, one nurse says this. We have to be together, whether it's a CRNA, certified midwife, clinical nurse specialists, nurse practitioners. We have to stand together. We have to be one voice. United we stand. You have Matt up here from GNA, Tim's out here. You got practice owners. You have people who work in the hospital, in the clinics. We have to stand together. So I'm gonna leave you. Each one, reach. All right, thank you.
Good morning, everyone. Good morning. That's sweet. Good morning, everyone. Good morning. My name is Dr. Michelle Nelson, and I am the proud past president of United Advanced Practice Registered Nurses. I wear a lot of hats in this state, but the most important hat that I wear is an advocate for access to care. Amen. You repeat after me. Forward ever, backward never. Forward ever, backward never. Forward ever, say it with some gas in the tank. Forward ever, backward never. Forward ever, backward never. We are not going back. This is our time. The people in that building right now, they don't know what they've done. They have woken up sleeping giants, have they not? This is the time for change. You are the change makers. We will stand together and make sure that not just APRNs get what they need, that Georgians get what they need, because access to quality, safe, timely, cost-effective care is not a privilege for those who are well-heeled and rich. It is a right for everyone. Do you believe that? Preach it, girl, preach it. I look out and I see former students. I see friends. Hey, Taylor. Hey, Mike. I see new friends. It takes all of us. In all the decades that I've been doing this, I've never seen such a catastrophe. And if you don't believe this is a catastrophe, I'm standing here with everything in my being to tell you this is a catastrophe of epic proportions, because this is not really about advanced practice nurses. This is about Georgians. Yes. Do we care about Georgians? Yes. Do we care about patients? Yes. Do we care about clients? Yes. I don't know how people could say that they care about Georgians and they care about patients, and they're actively doing everything to remove access to care in this state. Amen. You want to talk about the law and what's right? I think that's criminal. Who shouldn't get the access? Someone who looks like me? Someone who looks like you? Who's not getting the access? But I tell you what, we stand here today in conviction and firm in our beliefs that everyone in this state will have access to care. There are 11 million plus souls in this state. There are only about what? How many physicians? 30, 40,000? 30,000. We'll even give them 35. How many advanced practice nurses in the state? About 20,000. Add all of that together. Is that even enough to meet the needs of 11 million individuals? When you put onerous, outdated, unnecessary, and antiquated position statements, laws, regulations, whatever you want to call them, when you put them out, what you are effectively doing is saying that you don't care about patients. You can say all you want that you do, but you don't. What you are affecting and impacting at the highest levels is lives and livelihoods. Advanced practice nurses, we make six-figure salaries. We have insurance. We have all the things, and we can get them. But there are so many people that we are here fighting on behalf of today that cannot get those things. They have awakened a sleeping giant. This is our time. We will fight. We are just getting started. Are we just getting started? What I would like to see is sustained, coordinated, united, unified gatherings. You want to call it a rally, you want to call it a protest, you want to call it a full practice authority party, you want to call it a margarita get together. I don't care what you call it. But now is the time to show up and to make sure that we are fighting for substantive change. You want full practice authority? Do you want full practice authority? Y'all don't want full practice authority. Y'all don't want full practice authority. Because if you really want full practice authority, you're going to join these organizations. You're going to join these organizations today. I'm not done. Don't make me get down. Come stand with me.
No, I'm not going to stop you. That's what I'm not doing to them.
Y'all going to join UAPRN.
That's what I came to say.
Y'all going to join GNA.
Yes.
Y'all going to join, what's the other ones? All of them. All the things. AAMP, GAPNA, ABC, LMNP, XYZ. Get your money out and join. Act like you really want this. You don't want it. I said to Nancy today, and I'm gonna step back with this. This fight is like a well.
Oh, yes. Oh, yes, a big one.
We have been pouring into this well. I don't know about y'all. I can say for me, I have put everything on the line for this. Career, family, health, you name it, everything. And I'm not gonna stop. I'm not gonna stop. We will not stop. But you cannot come to the well. You cannot draw from the well. You cannot say that the water is not cold enough or that the water is boiling hot and you have not added to the well.
You better preach.
The well is a community. That's what this well is. And so I need you to show up not just with your finances and not just with your membership and not just with your voices. Show up and vote. Don't just be getting up and voting for any old body because you're a Democrat, Republican, or whatever. Those days are done. I am the party of nursing, and I intend to put people in place that understand that healthcare is the most important thing in this state. Healthcare is the most important thing in this state. And if whoever you're voting for is not saying that, then get rid of them. If they're in office, vote the bums out. You gotta vote.
Show up.
And don't just come to the well by yourself.
Yes.
Each one, reach one. If you brought one more person today, we'd be double our size. If you brought 2 more people, we'd be triple our size. Please go out and be our emissaries. Please go out and tell people what you witnessed today, the beginning of a revolution. Do you feel change on the horizon? That's not good enough. Do you feel change on the horizon? Let's make it happen. To our honorable and proud president who stops at nothing to make sure that UAPRN is moving forward, I thank you for your passion. I thank you for your leadership. Dig down in the pockets, y'all.
So don't
And
move.
get people hit. Yes.
Don't leave.
Don't leave.
Stay here.
Yes.
So just get your minds ready. They're going to do 2 things for a photo op. 1, without your signs, because we're going to be using it for our UAPRN updated picture. 2, with your signs for media. But let me just take a moment. When we talk about mentorship, I just need to take a liberty and tell you guys my personal story. About 3-ish years ago, I was a practice owner at that time. I've since sold my practice, but I was frustrated because I was a house call provider, couldn't get orders written for my patients, geriatric patients, rural care, Georgia. I was so mad, and I came across an article that said something about an ANP and something about a policy conference and blah, blah, blah. I said, I'm just going. Jumped on the plane, made the ticket the day before, jumped on the plane, went to DC by myself. Walked in, met an MP from California. Shout out to Dr. Charlotte. She says, have you met the Georgia team? I said, there's a team? Yeah. All right, let's go. Walked in, it was like fire. Dr. Nelson, Robin, Regina. I sat there, I was like, whew, found my tribe. Okay, what? Okay. Didn't have a clue, was lost. I didn't know what they were saying. I didn't know the term legislation. I didn't know didn't know anything, but I just showed up. Came back, looked for a chapter, couldn't find one. I said, I'm in Statesboro. Gwinnett, shout out to the Gwinnett chapter. Robin and Regina welcomed me with open arms. Shout out to Gwinnett.
That's right.
When I showed up, it was one of their somethings. I don't even know what it was.
Did a meeting.
Welcome right away. Came back again. I said, I'm coming back. My point is this. All I did was show up. Fast forward to the time for presidents in terms of elections, and they said, we want you to run. I said, but I just got here. I don't know. They were like, we want you to. I said, you know what? If you believe in me, let's do it. And
We
here
believe
I am.
in you.
And here I am.
We believe
I
in
say
you.
that to say, when I say the next president of UAPRN is here, I mean that from the bottom of my heart. We recognize the handful of souls you see representing UAPRN. 20 years. 20 years. We're going to keep fighting until the end, but we really need people to mentor. We want to success. That's one of my strategic initiatives for this organization, is a solid succession plan. But if we don't have those encounters, if we don't meet you, if I don't hear your passion, I don't know what your interests are. I'm going to give a shout out to the CNMs. I've been hearing from you. I did not hear. I have gotten so many emails, and trust me, I had to email one the other day. I said, I promise you I haven't forgotten you. There is a coalition budding for CNMs in our organization, and I'll admit we missed the mark. And I'll admit that. But we will find a coalition for the CNMs. And why did that happen? Because I heard from Dr. Patterson, and I heard from, and if you're here in the crowd, you email me, I forgot your name, I'm sorry. But Dr. Patterson, I'll give a shout out to Dr. Patterson. She did a podcast the other day, Mindful Moments with Dr. Pedro Morante. If you haven't checked it out, it's on social media right now. But she just reached out, she said, hey, I'm doing this podcast, will you sit with me? Gladly. Lynn, same thing. Lynn was doing an interview. Will you sit with me? Gladly. Heather Nade from Vidalia, same thing. We're here for, hey Heather, we're here for you. But trust and believe, we are your leadership. We're going to be the soldiers marching forward. But without you, this organization is literally nothing. So when we say come to the table, when we say June 13th, we're putting on an entire free event for members to mentor you, we mean it. And with that, before we transition to the photo op, any formal words from anyone? Did we miss anyone?
Is there anybody down there?
Anyone in the crowd that wants to give remarks before we transition? Juliana, come on up, Juliana. Our lobbyist, Juliana McConnell!
Thank you. I'm Juliana McConnell, and I've been your government relations lobbyist now for a decade. And your family, I mean, you know, and I've got family members who are APRNs. But this, as they've said, in all the years that we've been working together to represent you, we've never faced a crisis of this magnitude. And the one good thing, I see, it's like COVID, you know, even how terrible COVID was, there were a couple of things that came out of COVID that were actually good for us, that we found that we could have meetings through virtual meetings and not have to drive halfway across the state. But as they were saying, we've got to increase our numbers. One of your very, very I guess greatest supporters ever at the Gold Dome was Senator Renee Unterman, who unfortunately she retired year before last. But I sent a picture out to all of our members here that was taken across the street in the governor's office 9 years ago when she carried legislation for the APRN compact. And so many of that, and we had a full room at that time of leaders from UAPRN, GNA, and others who were there that day for that, I mean, very important piece of legislation. So, but I want to challenge you today to everything they've said. I just amplify tenfold. But when you leave today, we also ask you, reach out and send a message to your state representative, to your state legislator, and even one to the governor's office. Send one to the Board of Nursing and the Board of Medicine. You know, and we'll be glad. I know Nancy and the GR team's been great about putting a little sample message, but we've got to get you to reach out because they're reaching out to us. We had a call yesterday from the governor's office, and they actually told us that they had encouraged the medical board to please pause that statement. Also, I want to take a personal moment. They said, I've been your government relations representative for, like I said, almost a decade, but right now, in the last 2 years, through my firm, I've also joined with another couple who have worked so hard for you, and they're standing over there. Raise your hands to Wesley and Michelle Dunn, and thank them. Okay, between the two of them, they bring like 75 years of experience here. Wesley was a state legislator for 10 years, was chair insurance committee. So he actually brings that. He's written more legislation than anybody I know down here as a legislator and as a lobbyist. So we thank them, and they've been doing this out of the goodness of their heart now for 2 years. So, and they have adopted you as family too, and so, but thank you all again, and remind you, please, we can't emphasize enough, and get other people you know, send letters to your legislators, your senators, your reps, and the governor's office, and the two boards. Thank you.
Awesome. Thank you so much. We're going to take 2 more comments, then we're going to transition to that picture. Dr. Joanne Patterson is going to come up.
Hi, well, it's probably afternoon by now. It's morning still. My name is Dr. Joanne Patterson. I am a board-certified psychiatric nurse practitioner and the founder of Nurse Practitioners on Wheels. It is the first tiny house mobile mental health clinic in the United States and in Georgia.
Did you say award-winning? You didn't say that.
Award-winning.
That's right.
Psychiatric mobile mental health clinic. I have been featured on the Kelly Clarkson show because of this clinic. I have been awarded the 2025 Nurse Innovator of the Year by the American Psychiatric Nurses Association. And none of that would be possible if there wasn't a collaborative physician that I worked with via a third party. I'm not saying that that is the answer, the end all be all, but please take note that if we do not get what we need as APRNs in this state, we are going to have a public health crisis, a mental health crisis. We have it now. You're going to see ERs that are full.
That's right.
You're going to see suicidal rates increase.
That's right.
You're going to see violence. You are going to see a catastrophe unfold. So if we do not act and move as one on this issue, because we cannot continue down this path, it is ineffective, it is counterproductive, and we need to move, and we need to move now. I have never been into politics, but let me tell you something. This is not the time to say that you do not play politics.
That's right.
It is not the time. We have to do something about this. We are trained, we provide safe care, and we just need to get this done. Thank you.
Okay, we have one more speaker just taking liberties. Dr. Patterson and I are both from St. Croix, Virgin Islands. Shout out to the VI. So, oh, yeah, are you saying words as well? Okay, so we're gonna have 2 short comments. And let me just say this, for the photo op, so we're all gearing our minds. Those with the white coats and the pashminas, for those who weren't aware, legislative sessions, we usually do this. Don't feel discouraged. We'll ask you all to come forward. We're going to fall under the direction of the camera people, but we're going to use the steps and go forward, and it's going to be that kind of a vision. We're going to take 2 with signs, without signs. So let's start getting ready as we have our 2 final comments. Dr. Patterson.
Good morning, everyone. Good morning. Good morning. It's great to see you all here. It was hard getting up early to drive to Atlanta, but because I'm in McDonough on the south side. But it is important that we are here today. I'm Donna Patterson, nurse practitioner, Dr. Donna Patterson, board certified nurse practitioner. I work in a hospital setting as a cardiology nurse practitioner, and I also own my own medical spa. I am here because, as the sign said over there, APRNs bridge the gap. As you know, in a hospital setting, we do sick care. We're not here to compete with the doctors. We're here to support the doctors in the care that are provided to our patients. Patients are leaving the hospital diagnosed with diabetes, and they don't know what to do, what to eat, they have congestive heart failure. They have all these diagnoses that they're chronic. And we're here trying to help prevent these diagnoses. We're here to teach preventative care in our practices. And we're also here to manage these care when people are diagnosed. So it is important that we come together as one, as nurse practitioners, and support the cause so that we can get full practice authority, so that we can get the changes that are necessary to take care of our patients, to take care of our clients. Someone up here has 10,000 clients. What are they going to do if we're not able to take care of them? Getting a neurologist is so hard. It's taking a year to get an appointment. Getting a cardiology appointment, an OBGYN appointment, it is so hard. What are our patients supposed to do if we're not there to bridge the gap? So please bring someone out with you. Please go on your social media, share, comment, say something. We're not here to compete. We're not here to be targeted. We're not, oh, I don't want to say something because they might target my business. We are here to advocate for change. Thank you all for being here, and thank you for having me.
Hi, good morning, everyone. My name is Eartha Levy. I am a master's prepared nurse. I am not a practitioner. However, I am a nurse educator. And I just want to shout out, because a lot of you guys have social media streaming, for all RNs in Georgia to join this fight, because we need to support our nurse practitioners, especially they've mentioned mental health, healthcare deserts. Maternal health is near to my heart, and there are so many hospitals that have closed their facilities. And not only do they close the facilities, but they block the legislation for people to open the birth care centers. So we definitely need to unite our voices together. So thank you so much for your time, and let's stand together.
Listen, thank you. A round of applause for all the speakers. We know you guys, gosh, this has been since 7 o'clock this morning, or 6:30 or whatever, but we're gonna start wrapping up, but we're gonna capture this moment. So as we gather ourselves,